Okay, I guess I'm going to start my first official video with what exactly borderline personality disorder is. Now, I'm going to be reading this from my book, The Borderline Personality Disorder Survival Guide by Alexander L. Chapman and Kim Gratz, both PhDs, okay? So, I'm assuming that you came to this channel for a reason. Either you maybe have borderline, maybe you think you do, or maybe you know someone or you think that they might have it. A lot of other disorders, I guess you could say, also are a part of this, and I will get into that later on. But for now, I'm going to go over what it is. I will be referring to it as BPD most of the time, and I really want to let you guys know that I don't want you to use this as a way to diagnose yourself or anybody else, okay? And I'm not a professional. I'm basically speaking from experience. So, okay, so borderline personality. I'm going to go over psychiatric disorders, personality disorders, and BPD, okay? So, the Diagnostic and Statistical Manual of Mental Disorders, so that would be the DSM 4, I think. It's like a recipe book used by mental health professionals, and it lists the essential ingredients for particular psychological or emotional problems. So within this recipe book are two main types of psychiatric disorders. So there's clinical disorders and then there's personality disorders. Okay, so according to the DSM, BPD is a psychiatric disorder that fits within a large category of personality disorders. So we'll go over that. So the difference is a clinical disorder or syndrome can be anything from, well, some examples are depression, anxiety disorders such as panic disorders, generalized anxiety disorder, which is GAD, or social anxiety disorder, SAD, and schizophrenia. These disorders are seen as syndromes that people develop at various points in their lives. Some of these disorders may last for only a short period of time and have symptoms that improve quite quickly with treatment, such as panic disorder. Whereas others are generally more long-lasting and debilitating, such as schizophrenia. Okay, so the other category here is personality disorders. So what is a personality disorder? The idea here is that we all have typical ways of acting, feeling, thinking, and relating to the world, which makes up our personality. So whenever you say he or she is a real character, you are really referring to that person's personality or typical way of acting or relating to the world. A personality disorder is simply a long-lasting pattern of relating to the world that doesn't work very well. So in addition, these problems cause great distress and may create difficulties in relationships or lead to problems reaching goals in life. There are many different types of personality disorders, so including avoidant, obsessive compulsive, dependent, paranoid, schizoid, I say typical, but it's schizotypal, narcissistic, histrionic, antisocial, and of course borderline personality disorder. Having a personality disorder usually means having a set of problems that have been with you for a long time. Generally, you have to be an adult to be diagnosed with a personality disorder. However, people diagnosed with personality disorders as adults will often say that they have struggled with these problems for as long as they can remember. Okay. It says, it is believed that a lot of these people have had these problems since childhood. Speaking from experience, and people I have known that also struggle with personality disorders, it does trail pretty far back. So having a personality disorder does not mean that you have a flawed personality, possess poor character, or are a mean or unlikable person. Basically, the assumption is that people with personality disorders have something in their personalities that creates problems for them and for other people. Now, we don't entirely agree with this for a few reasons, as the author's speaking, not to me. First, the term personality disorder is problematic because it's often used interchangeably with phrases like character flaw, problem person, and difficult personality. And as we said before, this usage is not accurate. Second, the term suggests that the problem is inside you. In that if you could only fix yourself, everything would be normal. We disagree with this viewpoint as well. There's a lot of evidence that the environment, such as stress, trauma, abuse, and other such factors, play a strong role in many psychological problems, including personality disorders. In addition, placing the problem inside of you can create stigma and judgmental reactions on the part of other people. I can agree with that one. So finally, the term personality disorder also suggests that if you have a personality disorder, you have always had it. It's part of your personality, part of what makes you the person you are, and you always will have it. Just let me take a look here. Okay, anyways, it goes into a bunch of other stuff here. Okay, so as most other channels do, this is obviously my first video, my first full video. I am going to go over the 9 criteria used for diagnosing BPD, okay? If you don't already know them, if you do, you can skip ahead. Okay. Frantic efforts to avoid real or imagined abandonment. A pattern of intense and unstable interpersonal relationships characterized by alternating between extremes of idealization and evaluation. So that's I love you, I hate you, I love you, I hate you. Identity disturbance, markedly and persistently unstable self-image and sense of self. Impulsivity in at least 2 areas that is potentially self-damaging. So, suicide attempts, self-harm, gambling, risky driving, risky sex. Those are part of the category. Okay, next. Recurrent suicidal behavior, gestures, or self-mutilating behavior. Affective instability due to a marked reactivity of mood. Chronic feelings of emptiness. Inappropriate intense anger or difficulty controlling anger. Transient stress-related paranoid ideation or severe dissociative symptoms. That's a mouthful. Basically, what that means is, stress-related paranoia. Dissociating means pretty much stepping outside of your body. Not really being there. It is a way to cope. And it is usually, from what I've heard, learned in childhood. So, okay, so that's what it is, I guess. Now, obviously, we're not just going to be going by a book. But for anybody that wasn't too sure what exactly it was, that's the criteria, and that's basically what personality disorder means. A lot of people, I say a lot of people, there are studies that are done. They say, on one end of the scale, they say it's with you for life, and on the other side of the scale, they say it is curable. But each and every person's different, and I really don't know if they're going to be able to prove that. So I think it's all within us. So, not to sound preachy. So the reason I decided to start this channel, I actually have another channel. It's called ASMR Nova Star. And I guess I could quickly explain what ASMR means. It means autonomous sensory meridian response. And basically what that is, it is a feeling you get in the back of your head that can be, I know we all call them tingles. It does feel like tingles. It can be a warm preceding sensation down into your limbs or in your neck, and it usually is triggered. Now, these are good triggers I'm talking about, not the bad ones. Triggered by watching somebody do something very calmly, very gently, paying a lot of attention to what they're doing, and you just get this relaxed, tingly kind of feeling. Okay. Also whispering, foreign languages, all that kind of stuff. There's a whole community, and if any of this rings a bell, I suggest you check it out, because it is one of the only reasons that I have been able to sleep in the last few months is because of this community, and I also make videos. A lot of relaxation kind of videos. Stuff to help with stress, with anger, with nightmares. I am in no way trying to promote my channel here, but if anybody's really struggling and really having a hard time, it doesn't hurt to try something new. So I do have a link on my banner by my profile picture on my page. There's a link to my channel, but there's tons of channels. An amazing community. So that's one of the main reasons I decided to start this channel, because I had seen that I'm helping so many people. They have helped me so much. I wanted to give back, and just I thought I'd expand my horizons and maybe talk a little bit about some more stuff that I experience. Okay, so if you guys have any comments, feel free to leave them in the comments section. this is my first day with my channel, so I'll have more than enough time to check them out and comment back if you have any questions. Okay, and I will be in some videos for vlogs. I just am in one of those moods today. I don't know if anybody can relate. Don't really want to see anybody. Don't really feel like being in front of a camera. So, you guys will see me. Take care, guys. Have a good night.